So, looking at our model, obviously at this point we know what's going on. So we have blood supply, and blood supply shouldn't take too long. We have our arteries in red, our veins in blue, and we've shaved our muscle down to a little bit that's relevant. So we have a superior constrictor, a middle constrictor, and an inferior constrictor, and those are the ones that she focused on. But obviously, there's probably more. But what is important to note is that we have our brachiocephalic artery. Yes, I didn't want to guess, but it is the brachiocephalic artery. Comes up, comes the subclavian, and that becomes the axillary artery. But enough of that. It bifurcates into the subclavian artery and the common carotid artery. And the important thing is the subclavian artery drains most of the lower neck. Supplies most of the lower neck. So um, that will do that. Um, the common carotid artery will come up, and when it comes up, it's gonna become the external carotid artery, which will supply most of the upper middle and the upper neck. And I think this one, no, not that one. Yeah, that one is very important. So we have our superior thyroid artery, which if we go in and we look, our common carotid artery comes up, turns into the external carotid artery, and we have a branch off of the external carotid artery. Let's look at it from this angle. A branch off of it. Where's the name? Where's the name? External carotid branch, superior thyroid artery, and stylomastoid branch, and we have a infrahyoid branch of um, the superior thyroid artery. So this will provide blood supply to the neck. Since we have superior thyroid, facial artery, ascending pharyngeal, and maxillary artery. External carotid artery. Okay, so those are the ones that she hit on. She hit on external carotid artery, and that external becomes the superficial temporal artery. That's where in the brain. The maxillary artery that also supplies the upper area of the neck, and obviously the maxillary. So we have that maxillary artery coming off of the external carotid artery here at this junction and going lower, more from where it came from. We have our facial artery branching off of the external carotid artery that supplies middle, or supply most of the things, most of the muscles here, and also goes up and supplies the face. So it's from its name, facial artery and lingual artery, or angular artery. Okay, never mind. So we have that branching of facial and lingual artery. That was from unit 1. I have to focus on it now, but now we have our facial coming off of our external carotid artery, and external carotid artery originating from the common carotid artery. Now, when we rotate this way and we look at it from the posterior side, we have our ascending pharyngeal artery, which will, as we saw when we looked at the muscles, supplied blood supply to most of the muscles, the superior, middle, and inferior constrictor, esophageal constrictor. So we have that. Which one is that one? Superior thyroid artery is another one that she hits on. And if we go in and we rotate out of it, let's go down, let's go back up so we're not too close. We have our external carotid coming up. Then we have our superior thyroid branching off, supplying most of them. and we have our superior laryngeal artery, specifically the larynx and stuff. Then cricothyroid branch, all that good stuff. So we have common carotid, external carotid artery, superior thyroid branching off. Then we have superior thyroid branching off. When we go up a little bit, we have ascending pharyngeal artery branching off. Then right around that area, we have lingual artery. You keep coming up. Then above that we have our facial artery also branching up. So these will supply the face, the maxillary, mandible, the esophagus, the pharynx, all that muscles in here. So let's get our orientation right. That should be most of it for the blood supply. And let me see what she has. So she goes straight into lymphatics. So venous drainage, the important thing is we have our carotid artery supplying, but then we have our internal jugular vein draining the same areas supplied by the branches that come off of the common carotid and external carotid. So that is important to note. We have our facial vein, which will come off of our internal jugular vein, and we have our anterior branch of the retromandibular vein. I'm not sure if she mentions that one. So she mentioned pharyngeal and pterygoid plexus, facial, lingual, and superior thyroid vein drain to internal jugular vein, drains brain, face, thyroid gland, and neck. Okay, so now let's try to find them. So we have our internal jugular vein. We have our facial vein, which will drain the face and some of the neck. Shouldn't talk about that one. But superior thyroid vein, if we see here, we have our superior thyroid artery coming off of our external carotid artery, which will supply the neck. And we have our drainage of our thyroid area from the superior thyroid vein, which branches us off of the internal jugular vein. And obviously that would come off the brachiocephalic vein. No. It doesn't come off of it. It becomes the brachiocephalic vein, joins with the subclavian vein to become the axillary vein. Subclavian joins internal jugular vein, which becomes the brachiocephalic vein, goes into the SVC, and into all that. So we have our lingual artery vein also coming off of there, right next to the lingual artery, and they run kind of together. So let's try to find the other ones that she mentioned. So she mentioned facial. We found facial. We found our lingual, and we found our superior thyroid vein. Now the pterygoid plexus and the pharyngeal plexuses. Let's go backwards and see if we can find. Okay, external jugular, all the way up. Vertebral, external vertebral, facial, anterior jugular. Let's see, in here, external vertebral. Okay, so you can't really find it. I don't want to spend too much time just looking around. Anterior jugular left. But at least we know the big ones. The lingual, we have the facial, we have the superior thyroid. This is our facial one. And they're all coming off of the internal jugular vein. Anterior branch, alveoli, maxillary vein. Oh, thyroid, I think I found it. Pterygoid venous plexus. There we go. That would drain the anterior portion of the. Okay. So we have lateral pterygoid, we have a superior pharyngeal, and we have a pterygoid venous plexus, which looks like it's draining this area. What would we have? Posterior superior alveoli. It's draining the anterior part of the neck. Oh no, we're in the face. We're around the nose right now. So that's the mouth. That is the yeah. Those are the eyes. That's a superior pharyngeal constrictor. So in the face, around where the mandible will be, probably. So that's our pterygoid. The only one we didn't find is our pharyngeal plexus, and I think we will try to find it by looking. I think internal vertebral venous plexus, but okay. So we couldn't find lingual. Pharyngeal plexus, but at least we found pterygoid. Anyways, so now let's switch our attention round to lymphatics. And we spoke most about our lymphatics, but from anterior view, we see we had our palatine tonsils, important in our gag reflex once it gets touched or brushed, supplied by the glossopharyngeal nerve, that area. Well, if you cut that, you don't have the gag reflex, but we also spoke about pharyngeal tonsil. It's not shown here, but it's supposed to be in the oropharynx. Let me see if I can get rid of the muscle. Oops. Yeah, let me bring in the digestive tract. And now we don't see our palatine tonsil anymore. So I'm going to take you away and just leave that. We have our tonsil, palatine tonsil. What else we have? We have a pharyngeal tonsil, which is around the top here. So she speaks of tuberal tonsils, and tuberal tonsils, it says lymphatic tissue adjacent to the tonsils. So our pharyngeal tonsils lies in the pharyngeal arches. And one important thing is that our pharyngeal tonsils, so if we let's bring the digestive tract back, and maybe we can hit it one level. No, we can't. So we go in, it's up here. So palatine tonsils, so pharyngeal tonsils would be right around here, and they will sort of hang down from the nasal pharynx, poking into the oropharynx. But yeah, and when they are swollen, they are adenoids. When they are swollen, and the virus that usually affects the adenoids is the adenovirus. So adenovirus will affect it and cause the adenoids to be swollen. So the pharyngeal tonsil will swell. Palatine tonsils for gag reflex. Someone correct me if I'm wrong, but I keep saying that a lot. So we have our jugular-digastric and deep cervical nodes. But before I speak up those, we had our pharyngeal tonsil back when we were talking about the oropharynx, and that is our lingual tonsil. And our lingual tonsil is in the posterior aspect of the tongue, the posterior, around the posterior 1/3. Yep, posterior 1/3 of the tongue. And what she said is the collection of lymphoid nodes, yep, of the posterior 1/3 of the tongue, and drains to the jugular digastric and the deep cervical nodes. That's what we're going to talk about next. And our pharyngeal tonsil drains to the deep cervical nodes. So, if we can orient ourselves, where did I go? All right, there I am. I'll take you away. Take you away. Palatine. We take the muscle away and we'll look superior, deep cervical lymph nodes. So these ones, not the posterior ones, the superior deep and cervical lymph nodes are the ones that drains the lymph from the lingual tonsils. Right, deep cervical. Deep cervical. Okay, so that's deep cervical lymph nodes. They're just superior, and what would be the inferior? Posterior lateral superficial cervical. Nope. So yeah, we're right. These would be the superior deep lymphatics. Lymph nodes will drain the palatine tonsil, pharyngeal tonsil that will be up here, and the lingual tonsil, which is also in the back of the tongue. And our palatine tonsils will also drain into there. Now, what we need to find is our jugular-digastric, and it looked like it was on the outside. Yeah, maybe that one. That's the deep parotid jugular-digastric. Yep, there we go. It looked huge from the outside. It was hard to find from the inside. But the parotid, the lingual, which will be in the back of the tongue, and the pharyngeal tonsil will all drain to the deep cervical lymph node and the jugular digastric, since they all connect. And the jugular digastric will be this one, jugular lymph nodes. Anywho, so that's our lymph, and it's not much about that. Just knowing that those are the ones that will be drained into. And I think that's all with lymph. Next, we'll speak on swallow sequence, lingual tonsils, and palatine tonsil. Next, we'll speak on the esophagus tomorrow. All right. It was a pleasure working with you all, and my as disappeared, my motto. Yep, I'm just here by myself. Okay. All right. That will conclude arterial, venous, and lymph of the pharynx.